including the 3C framework, where we discuss the company, customer, and competition. Then we discussed the STP model, where we were discussing the segmentation, targeting, and positioning. And we ended at where we wanted to have an introduction of the 4 Ps in marketing. And that is where we're going to have our lecture today. So when you're discussing about the 4 Ps in reproductive health services, we are discussing an aspect of a marketing mix where the 4 Ps reflect the product, the place, the price, and promotion. So when you're discussing a product in the aspect of the 4 Ps, it means that when you're offering reproductive health services to individuals and communities, the components, the contraceptives, the maternal care, the family planning, counseling, infertility treatments, are the product that you're offering. And therefore, when you're offering the product, there is what we call branding. And I think in the frameworks that we looked at, you'll be able to understand that when you're using what we call the marketing mix as a way of portraying your reproductive health services, then you should be able to design your content in a way that is visible. And that is why we're saying in the aspect of a product, we are dealing with the material or the uniqueness in which you're providing a service to the community that you're targeting. So after having your segmentation, after having your people targeted and having your product positioned, you should be able to look at an aspect of how unique your product is. If you're offering contraceptives, then how unique are your contraceptives? So practically, if you look at the different contraceptives that are being offered in the market today, you should be able to realize that different companies are having different branding, and the branding is equivalent to their target group. There are those who are targeting young people, and you'll see that they put bright colors in their products, probably as a result of intentionally targeting the female gender, with the assumption that they prefer with the assumption that they prefer brighter aspects or brighter products uh, than their counterparts, the men who probably prefer colors, and therefore you would realize that in marketing of any other service, say it probably STI testing, you'll realize that the, 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 the idea of bringing in self tests was probably developed as a result of male involvement. Probably the realization is that men pay less attention to going to seek such health care at the health facility or at any testing point than females. That is why now they have resorted to possibilities that people can do self tests. So that is the kind of product and branding that you need to adopt. So the features in the product include how effective is the product. For example, if you're doing in malaria, if you're using RDTs, how effective is your RDT? You realize there are different organizations that are doing that are providing RDT, that are manufacturing RDT. So it is upon you as your own organization or as a service provider to understand how effective is my contraceptive, how effective is our maternal care, but also how effective is our family planning counseling. If you're offering counseling services to individuals and then you're realizing that the uptake of your family planning is still low, then you should be able to understand whether it is ineffective or it is effective. But also, if you're dealing with infertility, you should be able to understand effectiveness means that the outcome. the outcome, the intended outcome is realized. That is what effectiveness means. Then two, the features of a product. How safe is your product if it is used? Three is how accessible is your product? How easy can your target group access your product? How confidential are you? Well, that's where we bring the issue of confidentiality. Do you offer family planning? Yes. How confident, or how do you keep people's information? That is what we refer to confidentiality. But also, if you're offering STI services, how do you keep people's results? Do you just pin people's results, including those who have been found positive? So how do you deliver your information? But also, how affordable is your product? That's why we want to look at the aspect of affordability. Can people be able to buy your product? Can your target group be able to buy your product? So if you're making a product that is extremely expensive for your target group, the chances that you may realize your sales, or you may realize people are taking your products is very low. But also, what is the variety? That is why the other time I was telling you about the aspect of the Kiss condoms, where they have made different brands so that is what happens. For example, you can have STI testing, but there are a variety. There is using an RDT. There is using maybe a self test determine. So there are other. There is assisted partner notification. So there are different other ways through which people can do the testing. You will realize that when COVID started, initially there was only one way through which the testing was being done, and that was the swab, where they had to put that swab into your nostrils and get your muco conjugation. Then they take it to the laboratory. But later on, they realized that kind of picking a sample was extremely was not favoring majority of the clients, and that is why probably very many people did not go for COVID tests. So later, the other DTs were developed, and also some other ways through which testing is being done, and then you would be able to do a variety of tests. You can choose from what you like, or from what you like. Then another feature of a product should be its quality. How good is your product to perform the role it is supposed to to perform. So those are some of the considerations when we're discussing the product. So in that aspect, you should be able to put it in all these components of reproductive health that we've discussed here. You should be able to put the aspect of quality in contraceptives. You should be able to put you should be able to put it in the aspect of maternal care. You should be able to put quality in the aspects of family planning. Uh, you should be able to put it in fertility treatments, that you have quality in offering your services. So the other second P is what we call the price, and a price is the cost associated with accessing reproductive health services. Sometimes it might be a monetary value, but sometimes it may not also be a monetary value. But in this regard, we're looking at what are some of the costs that are associated with accessing reproductive health, and therefore we are looking at what are the costs associated with accessing reproductive health. costs, what is the insurance coverage, but also what are the government subsidies and so consider how affordable is this for my target population, as I earlier said. But also, you should be able to look at, is it cost effective? So when you're looking at cost effectiveness, you're also looking at it from the point of the manufacturer, you as the service provider, and the person who your client who is benefiting, in terms of how cost effective is it for this person. Someone may use transport that is way beyond the service that is being offered. So some of these challenges should be addressed by taking and financial assistance programs. So these are some of the products programs that are coming up. For example, that in the banking sector, they are offering financial literacy trainings to their customers. So if you join the new bank, they might recruit you to do a financial literacy course where they can teach you how you can manage your monies or some of the investments that you can do in order to make more money or in order to do some savings. But also they can be able to train you on how to run a circle or a social kind of savings group that is communally accepted. So those are some of the issues that you should be able to take into account. So thirdly is what we call play. Reproductive health services are delivered. And in this case, we're looking at the health facilities, clinics, hospitals, pharmacies, the community centers, or as the places where reproductive health services can be offered or delivered. So, considerations, you have to be able to consider the accessibility, convenience, proximity to target population, privacy, comfort, infrastructure, availability of trained staff. So, meaning how when this comes to the aspect of positioning, how do you position your product? For example, you wanted to uh, there's a strategy an organization used in Uganda the last time. They realized that men were actually fearing to go and pick certain contraceptives, especially condoms in the health facilities. All men were struggling to buy these contraceptives from open market or from the open place, probably because of the shyness or because of the hardships sometimes in going to buy these things. So what they did is they developed what they call these condom sites or boxes along the roadside. And what would happen is that in the evening hours, when it's about getting dark, they will go and place them all over those places. But in the morning, when you go and check, you will realize that there is actually nothing. So meaning that all the things were already being taken, but in hiding. So those are some of the strategies that you can actually use. Two is convenience. So when you're referring to convenience, you should be able to make it easier for someone to use your product or to access a service. So sometimes the challenge is that in a health facility, when someone goes for a reproductive health service, maybe for HIV testing or for counseling or for maternal care, you subject them to very long line, a very long queue. So sometimes this is seen as a delay, and therefore people sometimes prefer not to go for such services because of the inconveniences that happen, such as the long time that can be spent there, but also there is the attitude of the healthcare worker. That is why you need a monitoring and evaluation person in your health facility or in your clinic. Now as a demographer, you should be able to have those skills. Can you be able to create an opinion box where you question, or can you be able to develop a health facility quality assessment template where you're able to ask your clients how convenient they feel in accessing your service, and then they can be able to suggest for you. So you will be asking questions against attitudes of your client, of your support staff, or of your staff. Then that feedback is the one you will be able to use to assess the convenience. Thirdly, we talk about the proximity to target population, meaning how near is your service to the target population. So you may not put a health facility very far away from the population or from the community, and you expect that they go there and access a service. So some of the ways in which you can address the issues of proximity is through doing the outreaches, where you go deeper to the community so that you're able to offer them near services. But also sometimes huge organizations have developed issues of transport. For example, organizations that are handling circumcision, you'll realize that they offer transport, but also sometimes they offer certain incentives to people who access their services. So they go around picking young people and offering them transport so that they can go and access safe male circumcision in the health facilities. Four is privacy. Then we have comfort, more or less like convenience, privacy, more or less like confidentiality. But also, we want to see if the infrastructure is there, and then the availability of trained staff. So you may not be able to handle your clients under the mango tree. It is more important that you have structures that are convenient for your clients in there. And then lastly, in the four P's, we look at promotion. Therefore, here we are referring to your marketing efforts to raise awareness and encourage utilization of reproductive health services. And the components include your advertising campaigns, your education programs. The last time we discussed health, the last time you we discussed health promotion, and many of you I think attending those particular lectures. So when you're promoting your reproductive health services, the same principles you use in health education are the same principles that you will use here when you're promoting your reproductive health services, so they do not vary at all. So you need to be able to have educational programs. You need to be able to have social media presence, but also outreach events, partnership with community organizations, testimonials, and word of mouth of referrals. So if you're able to pick community members who have access to your service, for example, if you are offering infertility services, and then you have people who were infertile then, and through your service have been able to bear children, then it is upon you as a way of promoting your service to be able to tell these guys to come in and have testimonials, go and give testimonies. They should be able to go and give testimonies on what worked for them and how possible it is for them to get the problem that they are suffering from. So how you are able to convince them matters a lot, and that is what promotion is all about. So you as well can be able to partner with community organizations, and when you're referring to community organizations from the practical aspects, most times these things work. For example, if you do your underground research, you will realize that in African traditions, of recent, the majority of the communities are religious. And therefore, it is fairer that you partner with even religious organizations in the community so that the promotion is easier and the acceptability is easier. Similarly, you should also be able to partner with government because government is one of the government is the hugest or the biggest resource you have because every person looks up to them. But also, you shouldn't be able to live along. You shouldn't be able to live the traditional organizations because the beliefs, the practices, and the values and morals that the community follows are originating from particularly those traditional aspects. So the moment you capture them, it will be easier for you to do the promotion. So when you're looking at the objectives of your health promotion, because one, if you're doing advertising campaigns, then you want to increase the knowledge about the available services. For example, you want to tell people that these services are available, this is how you can get them, this is where you can get them. That is how you should be able to advertise. Then your educational programs can be able to reduce stigma, but also they can be able to promote healthy behaviors. And then they can encourage regular checkups, highlight benefits and features of services. And as well, they can help in breaking the myths that individuals have against it can help in breaking the myths that individuals have on some of the health or on some of the reproductive health services that are being offered, and probably the reason as to why people do not seek those some of those services. So we now want to look at the aspect of branding because we earlier looked at the product. So you need to brand, and that is what gives a plus to your reproductive health service that you're offering. So a brand is a name, symbol, design, or other feature that distinguishes a product or service from its competitors in the eyes of the customers. Or it is a set of associations, expectations, and perception that consumers have about a product or services based on their experiences and interactions with it. Or it can be defined as a promise of value and quality that a product or service delivers to its target market and stakeholders. So when you're defining brand, you can be able to see here that whereas we are defining brand and a physical aspect, we're also defining it as a service from a service point of view. Because sometimes your service may not require offering a physical aspect. For example, you may not be selling a bar of soap, but you may be offering someone maternal care services. So that is why if you're offering someone maternal services, then you're looking at a brand as a promise of value and quality, or you're looking at it as an expectation. What does this person expect after attending an antenatal care service? What is the perception that the person has about going in for antenatal care services? So if you branded your antenatal care services, that any woman who attends 4 antenatal visits and above, during the delivery, if the person comes to deliver to the health facility, you will offer them a bucket, or you'll offer them soap, or you'll offer them a mama's kit. Then you're looking at those are all ways of branding. And in that kind of branding, then you're able to attract clients to come and do and take up your service. So when we have the different brands of elements of branding, and we're looking at the brand name. What is your brand name? And when you're talking about the brand name, you should be able to put a name that is equivalent or is relevant to a certain target group. So, for example, if you wanted to deal with the youth alone, you cannot have a brand name that is not associated with youth. For example, you can say youth can, youth yes, yes youth. So you should be having a brand name that is associated with who. You need to have an online access. That's why we call it URIs. So in that URL, you do you have a link where people can go and read more about your product? Two, you should be having a logo. A logo gives you identity on your belief. That is why, if you're looking at the car producing companies, you will be able to know what is the brand of Toyota, what is the brand of Total, the oil company, what is the brand of that particular fueling station that you have that you know. They all do have branding. Any other product, whether it is a book, whether it is a sugar, whether it is what, they always have a logo. And even for your reproductive health service that you're offering, for example, if you're offering HIV testing, you should be able to write there at least maybe HTS and put a cycle or something and something that the people can be able to understand. But you should also be able to have a symbol. You should be able to have a symbol. Most times you can be able to see for those football clubs, they have probably something like a dragon, a lion, those kind of symbols. So probably as a reproductive health service, if you're offering antenatal care, maybe the symbol should be there, probably showing how attending 4 antenatal visits lets a mother have a healthy baby, eh? A baby that is happy, jolly. So those are some of the symbols in branding. But also you should be able to have characters, and these are writings. And then spokespeople, you should be able to have people who can be able to talk about to freely talk about your product or your brand. Then you should have slogans. For example, the American slogans of "Yes, we can." eh, they are always different different organizations have different uh, uh, slogans. For example, Coca-Cola, test the feeling. So, as a service provider, you should also be able to have yours. Effective healing and so forth and so on. So that is branding in terms of slogan. You should also be able to package. You should be able to have signage. For example, a signage of where does this thing lead? Where does this thing lead? You should be able to have those signposts that you're offering such a product. So, what are some of the importances of brands? They are higher margins and competitive advantage. They help in customer loyalty and forgiveness. There's employee retention and motivation. It enables premium pricing, greater volume, but also aids recognition and facilitation, meaning that if you have a good branding, the possibility that you may get aid or recognition or some kind of donor funding is as well there. But also it creates barriers to entry. So, meaning that people are able the possibility that every other person can enter that kind of business is limited because they know that there's a giant. Take, for example, telecommunication industries. There are telecommunication industries, probably, I don't know, but here, mainly in Uganda, most times it is about MTN and Airtel. So when MTN is predominant, they have made sure that they connect throughout the country, even in the villages or the rural areas. And therefore, they have created a barrier for new entries to come in. If you wanted to offer a certain service, you'll be scared that there is already a giant. Similarly, if you have a very good branding of your services in a particular area, you'll create a barrier for people to enter into that same kind of adventure or business. But also, it helps in identifying product source and quality. So that is the importance to to the consumer or to the customer. So you'll be able to know that this product is from this and this. Therefore, it helps in reducing risks and such costs. So you would be able to know, for example, if you named your bar soap White Star, so you will go to a canteen or to where they sell to the supermarket, knowing that you're going to buy this brand of soap. So that it reduces searching. You will not need to go and search all over for different for different uh, for the different types for the different types of soap, because you already know that particularly you have soap that you recognize as White Star at in where you're going to buy from, so it will be easy for you to go in there and buy. So what is again the role to the brand manager? The role is that identifying and developing brand plans, then designing branding, marketing programs, and measuring brand success, then growing and sustaining brands over time. So, as the brand manager, you can be able to identify where there is need for improvement, or how you can be able to have uh, a better way of designing again, or you can be able to understand whether your brand is being a success or there is need to adjust a few things. Then, what are some of the misconceptions about brands? We have a lot of misconceptions about brands. One, brands are just logos. They encompass much more values, personality, experience, and emotions. So brands are not just logos alone. Brands are a whole aspect, and that's why when we're defining branding, we're looking at it from another perspective, including people's perceptions, including their expectations. So branding is not just a logo alone. Branding is expensive. Effective strategies exist for all budgets. So the misconception is most times that branding is expensive. However, what is effective can work for all budgets. So it is about you to be able to understand what is cost effective. So in other words, branding is not actually expensive, but it is just about how, as an individual or how, as an organization, you should be able to strategize and then be able to have the most effective branding for your budget. Then branding is a one-time event, which is not true, because branding you need to evolve all the time. And I will continue to refer to huge organizations, parastatals such as Coca-Cola, where you see them changing their branding all the time. Sometimes you can see that how branding has evolved. Before, sodas used to be packaged in glass bottles. However, you've seen how the branding has shifted drastically to plastic bottles. So this is how branding continuously evolves, and even the packaging of your product is part of the branding. You can be able to see how some of the bottles are made, but also how the containers are made. eh. You may see if you're dealing with reproductive health services such as HIV testing, you'll realize that one brand has a test kit that is circular, then another one has a rectangular one. So these keep on evolving. Then there's another misconception that branding is only marketing. So branding is not only marketing. Branding involves how you package, branding involves your logos and all those aspects that we talked about in the components of branding. Then branding sells products, it builds trust, loyalty, and emotional connections, which is not the misconception, which is the misconception in there. So when you're branding your products, it depends on how you convince your target group. Then the good products sell themselves, branding helps them stand out and connect. So branding actually is branding helps you if you have a product, good product, for you to have a good product, then in branding you must be having quality, and that is why if you have quality, then you will be able to attract as many customers as possible. Then successful brands are allowed, different approaches can be successful. Most times it is not true that every successful brand is widespread or is very loud. So if you have a different approach, there is also a possibility that you can actually be successful. Then branding is a magic, which is not true. That is just a misconception, because branding requires effort, strategy, and understanding your audience. Then copying successful brands ensures success, which is not true. So you may be copying from some other person, and you think because you've copied, then the possibility that you will be able to be successful as the person is a very huge lie. Then branding is a thread. It is fundamental for long-term business growth. So branding is not just a short-term aspect. In branding, you have to continuously brand, and in the long term, it is very important for you to keep that particular brand. So that is how far branding takes us. And the next aspect, the next aspect which I want us to look at is building strong brands. And let me just share with you uh, something here about that. From what I've presented, do you have any questions on what I've presented? So that in the next probably 10 minutes, I can have a quick run through into the aspect of building a strong brand. Then we can be able to, or we look at that tomorrow. I don't know. Can we be able to introduce building a strong brand today? Or we can look at that tomorrow.